The digital workflow is the backbone of practice.
Yeah, I have a very laptop-driven practice. I like data to be carried with me everywhere I go. Digital workflows reduce redundancy.
So what he's viewing on the Artivo or the scope screen is exactly what I'm able to view on the Quatera screen. So I can load a lens or do something on my back table, but also be able to view what's going on during the surgery.
We want all those features and then want to be able to take advantage of it in the operating suite. When you hook it up with an Artivo or a Lumera, and you get to be able to pull down from the cloud through Veracity, and then be able to coordinate that with the Quatera, have the patient's ID and lens selection, everything show up, you close the loop essentially on the whole process.
So I think this integrating idea is pretty good.
This completes the workflow.